First, I would like to ask for your permission to use this video for educational purpose.
Yes.
Excellent. Now, tell me about your life, and your symptoms before the surgery.
Pretty active guy. I'd work a lot. I was having some significant back pain, lower pain.
Mm-hmm.
It was restricting me what I could do a lot.
1 to 10, how bad was that pain?
8. It was up there, sometimes 10.
Okay. And for how many years?
Quite a few. I lost count of how many years I struggled with it.
How did you deal with it in all those years?
I just dealt with it. A little chiropractor helped a little bit, but for the most part, I just suffered through it.
So we put you to some rigorous test, and then we found out the bottom 2 discs are causing you a problem.
Yes.
And I'm just going to turn here. We did a 2-level fusion for you, and here you see that we have the screws here put in the L4-5 and S1. And if you look carefully, actually we see that bone in the back is growing, as well as bone here. Bone in the front is growing here. So we are about a year after the surgery, and the bone is growing, but you are not one of my best results. We talked about that. You had that nerve irritation that we talked about 15% of the people get.
Yep.
Can you describe that symptom to us, how it was?
It was a sharp burning pain down my leg and my foot.
And you were even weak. You
Yes,
had
I had lost some strength in my foot.
Yeah, you had what we call L5 nerve root irritation from the procedure itself, that literally we had to push that nerve to the side to get in. Now, interestingly, that risk as well exists after open surgery. At least in our study, we noticed that risk after open surgery is higher than after our surgery. But in a way, after our surgery, this is the only symptoms left, and people are noticing that subjectively much more. So why don't you describe that symptoms a little more?
Pain, burning, stabbing.
How long did that stabbing pain last?
It lasted quite a while. I'd say 6 months, maybe more.
Okay, and you had one of the worst degree of that, what you call neuropraxia.
Yeah.
Okay, but in my today exam, your strength is actually full.
Strength is great, awesome. Every now and then there's just a little tingling, burning down there, nothing major, and it's nothing I can't live with.
Yeah, and so the pain went away, and that as well, that weakness actually completely has recovered.
Yes.
And are you back to your basic daily activity?
Yes, I am.
What can you not do?
I guess I haven't found anything I can't do. I haven't tried lifting too much yet.
Okay. And and with this nerve root irritation that we talked about that you went through, do you think overall it has been worth it to go through this?
Very worth it. I mean, from where I started, where I was, I am 1,000 times better. I'm not 100% yet, but I haven't been 100% for a while.
Okay.
And I'm still way better than I was.
Okay. Now, as well, we as well talked about that some of my colleagues, they tell, unfortunately, patient in your situation, and your BMI is high. Your BMI is 44, I believe, or so. And some of my colleagues tell the patient, go lose 100 pounds and come back. And I think it's pretty hard to lose 100 pounds if you
are in pain.
If you're in pain.
Yeah, it's hard to, I'd get through the day. And I'm an active guy, but by the time I got done, I wasn't feeling good to go walk or work out or anything. I was pretty well shot.
And I think that is why what we do is so important, because we found out that we can do that same surgery as safe in higher BMI than lower BMI. So losing weight is not a criteria for us, whereas every other surgery is much more dangerous.
Yes.
With this. So, and I think obviously you are not one of my best results, because my best results don't have that nerve root irritation, which is most of the people. But it's still, I think it's important to see that that can happen statistically, but most of the time it's recovered, and the end result is actually pretty favorable, as you see.
Very favorable. I'm very happy.
Excellent. Do you have any question, any comment?
No.
Okay, thank you so much for the interview.